Why doctors don't want to open the practice? I mean, like, let's assume there is like monopolies happening around, there is a lot of, let's say, things happening, so still, like, maybe still might appear a question in your mind why they just don't want to open their own practice. And here is, yeah, I was checking with some of the doctors and turned on that starting like right after the COVID, a lot of doctors who even initially were thinking, okay, maybe makes sense to open the practice, now actually skip this idea and they don't consider it anymore and don't think that it's valid and good idea anyhow. Reasons, I mean, I'll just put the list, but the list of course is not limited. First one, already was mentioned, KV permits. They are limited and already purchased by corporations or investment funds in very good areas, so, or in the potentially good areas, or they're just purchased by another, let's say, big praxis, or let's say other praxis as well, or owners. There are available some KV permits, that's for sure, in high-risk areas. High risk in this case means, for example, low density in the population, or for example some very small, relatively small cities where population goes down, so there is very high risk that you might not be able actually to be profitable even, and that's also one of the reasons why corporations also don't really want to go there. But yes, there are some locations where you can get the KV permit. And it's not interesting for also normal human or normal, let's say, doctor, because there's very high risk, just that you will work and you will get nothing at the end. Why they also don't want to open the practice? You get a lot of obligations in front of the KV. Pile of them I have mentioned already in let's say, before, in the past. And the thing is that it feels like that KV in general basically doesn't invest anything into this doctor. They rather give doctor a chance to make invoices to the public insurance, and that's mainly it. So like on the one side you have the chance to invoice up to 90% of the residents in Germany. Sounds good. On the other side, you have the regulations from the KV itself, like what you need to do, how many hours you need to work, like that you need to do some kind of, let's say, a dienst. Forgot proper translation for the dienst. Anyway, duties, for example, overnights, over weekends. They also tell you that, yeah, you shouldn't earn more than this amount because, like, the amount of patients, you shouldn't go on the higher levels, otherwise you will not be paid. And like limitations here, limitations there. There is a lot of limitations, and a bunch of things can be actually changed just through the law. So, or for example, just regulation. Now we don't pay, or we reduce wage for this and that type of the things. So kind of on the one side you have a chance, on the other side you have too many obligations, requirements, and a big pile of uncertainty. So yeah, young doctors, or in general doctors, they decide not to take this responsibility, big pile of obligations in front of KV and this type of uncertainty on their shoulders, if they don't know what's gonna happen. It's pretty much same as in direction of the actually patients or someone who has the public insurance. Same, the coverage can be changed and they cannot object it anyhow. Also, like worsening of the insurance coverage of the public insurance in general leads that patient at the end is not that happy. It became more and more unhappy at the end. They start to demand more from the doctor, ask questions. Like a bunch of doctors with whom I was talking also tell that, yeah, there's a bunch of patients just complaining that this is not covered, I had to pay that or that. So yes, wonderful, but for example, if you're a specialist and you now have very limited amount of time to help this patient and then you need to switch to another one, And yeah, you can also understand patient want to also like explain maybe some unhappinesses. He was waiting for this appointment for, I don't know, like 3 months or 4 months or even 6 months, and now doctor just can deduct for you only like 5 or 3 minutes of their time. Of course it makes person also unhappy, especially when person understands that also he needs to pay or she needs to pay on the top for some kind of additional checkups just to get better understanding for doctor what is happening. Yeah, in many cases it provokes scandals, some dissatisfaction by both parties, by patient and by doctors, by the nurses and anyone who's working the praxis. But yeah, the flow goes, money flow goes, so kind of the things seems to be okay-ish. Also, what own practice means? It means obligations, not only like in front of the KV, but also employees. You have a contract with employees. You need, for example, at least maybe one nurse to support in particular, let's say, manipulations. You might need someone who would stand on the reception to let's say, answer the calls and things like that. So you might have at least like 1 or 2 contracts on the top. So there is another humans who are gonna be assigned on you, and you would have a contractual obligation in front of them that you need to pay them salary, some kind of money, maybe even bonuses when it's possible, and things like that. So it's pretty much hard, and in Germany it's also very hard to fire a person when something, let's say, when you feel that okay, now you're not that profitable, or there is changes in the law or whatever. So it might not be that easy. And basically it just turns on that if you're in the small practice, so if you have opened a small practice which doesn't do any surgeries, then yeah, you might be caught between the devil and deep sea. On the one side it's gonna be KV, on the other side gonna be contract obligations, social system, and some other things. Also on the top you need to sign another insurances. You also, like as the owner of the praxis, you need to sign some insurances, for example, like regarding your operational field and things like that, ensure that your employees are insured. So it's additional, let's say, pile of money which you just need to consider to pay constantly. So yeah, except for having a big pile of insurances which you need to make when you own the praxis and to comply with the pile of regulations at the end, there's still on the top gonna be a lot of bureaucracy which you need to handle, like to fill up the papers. On the other side, also like demanding more and more KV. Unhappy patients, which you also need to deal with, especially when you're owner. And yeah, at the outcome you might still get pretty much small financial outcome, because yeah, if we talk about small non-operational or not surgical practice which doesn't make a surgeries, yeah, as an owner you might actually earn at the end, after all, is less than you could earn just by working as an employee in any kind of company or maybe even another country at the end, and without any obligations. So that's why in many cases doctors just try to see pros and cons, and they decide, okay, I don't want to open and I don't want to have a lot of obligations. And some of them who have sold their practice, they told like, finally, get rid of it. So yeah. Plus, on the top of that, there is still uncertain situation in the reforming of the health system, because like rumors here and there appearing that there could be some kind of changes, and in most cases these changes would appear in the increasing of the workloads for the practice owners or for the doctors at the end. For example, there are some hospitals going to be closed because of the reformations on, and yeah, guess where these patients would go from the hospitals. So yeah, also like there are sometimes politicians making very loud words regarding that we would provide everyone good treatments and things like that. So there's just, it's not limited with this list.